Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk to you about vaccination and how to keep your child healthy. Vaccination, also called immunization, helps the body fight infection. It is one of the most impactful discoveries which has improved child health worldwide, and all the infectious diseases which were big killers in the past are now either removed like smallpox or curtailed like pertussis. So what is vaccination and how does it work? We introduce attenuated or dead bacteria or viruses in the blood, which means what we are doing is we are showing the photograph of the bad guys to our police system or to the immune system so that they can produce bullets to kill the bad guys. So the body becomes stronger at fighting infections than before. One of the most important questions parents ask their pediatricians is, are the vaccines safe? Is it okay to give the baby a vaccination, and so many vaccinations at that? Generally, vaccines are safe, and as I said before, they protect the child against grave diseases. Most of the time, vaccines are either dead bacteria or viruses which have the same structure. They may be attenuated, that means they're so weakened that they produce the antibodies but they do not produce the disease. And sometimes they are just subunits or toxoids produced by the bug. The greatest controversy in recent times is the association of vaccines with autism. As of now, studies have not shown a very robust relationship between the two, though there are still lingering doubts amongst parents. If you have a family history or you have real concerns, talk to your practitioner about a differential schedule rather than not giving vaccinations at all. If your child misses a dose, that doesn't mean that he should not take any more vaccines, because there are catch-up schedules advised by the CDC and other vaccination programs. Minor coughs and colds do not interfere with vaccinations. This is just to show you a picture of what polio did in the 50s before the advent of polio vaccine. A horrifying picture of the iron lungs, as they were called, where children were kept in these machines because they could not breathe, because the polio had paralyzed their respiratory muscles, and it was a horrible situation. And now polio is more or less controlled. You do have some sporadic problems in some parts of the world, and similarly things like whooping cough, diphtheria, tetanus, these very horrific diseases have been controlled. So what are the side effects of vaccines? Usually they are minor. At the local site of the injection, there may be swelling, tenderness, and what is advised is just to put some cool compresses. Sometimes a baby gets fever over 38 degrees, and if so, some paracetamol can be given, but only if the fever is about 38. Sometimes children after MMR or chickenpox develop a fine rash. They may be a little irritable. If there is excessive crying or any unusual problems like floppiness or fits, you must immediately go to the hospital. This is a vaccination schedule as in the UAE, as authorized by the government. Baby at birth is given BCG and hepatitis B, and that's mandatory. At 2 months, they are given vaccinations against diphtheria, polio, tetanus, H influenza, hepatitis B, pneumococcal, and rota. And these are repeated at 2 months, 4 months, and 6 months, and at 1.5 and 4.5 years, so that the child becomes completely immune to these medications. Vaccinations are optional, like the meningitis, the chickenpox, the typhoid, and hepatitis A. But if you are from the country where these are endemic, you should take it. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below, 04 429 8498. Thank you.